Today is October 1st, the start of Breast Cancer Awareness Month, and to mark that, several fountains in the city are now flowing pink, including this one in Gateway Center. More and more women are surviving breast cancer, but with that comes the risk of the cancer spreading elsewhere and making it more difficult to treat.
Now, a new treatment is showing promise. Here's health editor Dr. Maria Simbra.
A shock, really.
Judy Atkinson has metastatic breast cancer.
I didn't realize I had cancer at all. And then I thought it was going to be the end.
The cancer has spread beyond the breast and the lymph nodes under her arm. In her case, it's in her bones. She tried different medications, but had some setbacks.
I took that for a while, and then that started to not work anymore.
This condition is daunting.
We think of it as being incurable.
But for breast cancers with estrogen receptors, there are medicines to keep it in check.
They feed off estrogen. So an anti-estrogen pill, which is what we generally use, can be very effective in controlling disease wherever it is.
But what happens when the cancer comes back despite these treatments? A new class of drug can be added. Cancer cells rapidly divide, and these drugs interfere with proteins important to cell division. They're called KDKA-4/6 inhibitors, and 3 are currently on the market.
This can delay the time by years that somebody needs to be on chemotherapy.
If organs aren't functioning because of the cancer, chemotherapy is the better choice. But these new medicines are ideal for people with metastatic disease and are otherwise healthy. Blood work is monitored every 2 weeks at first, then monthly. Side effects include a low white blood cell count and the risk of infection. Also, diarrhea. The drugs became available in 2015, so we don't have long-term outcomes and effects yet. They are covered by insurance, but the amount of copay and coverage varies widely. Judy gets her prescription through a drug company program.
I don't pay anything for that, and that's a very expensive pill, and I haven't paid a nickel, which is pretty darn good.
These drugs were first FDA approved in postmenopausal women, but now premenopausal women too. Judy is a 10-year survivor and still has high hopes.
I'll stay on this as long as I can. I have my kids, and my husband, and I'm still active. I just want to keep going.
I'm Dr. Maria Simbra, KDKA-TV News.